Sure.
All right, go ahead.
Okay. Mark, if I look straight ahead,
Just
are you going to
look
decide
at the
me?
camera. Yeah,
Look at the
just
camera.
at the-
Okay.
yeah.
Thank you.
Yeah.
So I am Dana Matkovic. I am a local health insurance broker, and I specialize in Medicare. So I help people with enrollments in a Medigap plan, a prescription drug plan, or a Medicare Advantage plan, and I have a few other types of products that I also help people with. But I really like being a resource to my clients, helping them to find savings on prescription drug plans and any other resources that are available to help them with their Medicare needs. So, the goals of this presentation tonight are to show you different tips on how you might be able to find savings on your prescription drugs that you get through a Medicare prescription drug plan or through a Medicare Advantage drug plan. So, let's see here. There are a few ways that you can start to try to get savings on any costly prescription medications. First thing is that any prescription drug plan that you will have with Medicare, whether it's a standalone prescription drug plan or a Medicare Advantage plan, will have a formulary. And the formulary is a list of every medication that is included in your drug plan. And every drug that is included on that formulary will be assigned a tier. And that tier will determine what the cost is of that medication. So if you have a prescription drug that you're prescribed and all of a sudden it's a new prescription for you and it's not on the formulary, you can request a formulary exception from your insurance carrier. And if you're not familiar with doing that, you can call the member services on the back of your member ID card or call your agent. Your agent should be able to walk you through the process of requesting a formulary exception. And if that formulary exception is granted, then you'll have that prescription on their formulary for the remainder of that year. And the following year, you might want to consider switching to a different prescription drug plan that has that medication on the formulary so that you're getting the best price for that medication. Another thing you can do if you have a medication that's very costly is you can request, hello, I'm going to pause for a second since we have somebody coming in now. Good evening.
Hi, wow, okay.
Good evening.
Hi, Dave. Good evening.
Are you here for the prescription drug cost
Yes.
savings? Have a seat.
Okay.
Is this it?
This is it.
There are some people
We only had one
watching it
person
on,
signed up in person, but.
Yeah, and there's some
Your
people
brother.
watching it on Zoom.
Ah, okay.
Okay, good.
Yeah. So I'll backtrack a little bit. My name is Dana Matkovic. Welcome to the presentation.
Sorry, Dana.
That's okay. I am a local healthcare insurance agent and I specialize in Medicare. So I help people finding Medigap plans, Medicare Advantage plans, prescription drug plans, anything related to Medicare. I like to help people find resources in the community to help them with anything that they need help with Medicare. So right now I'm talking about some basic tips on finding cost savings with Medicare. If you get prescriptions through any type of Medicare plan, it's either a standalone prescription drug plan or it could be a Medicare Advantage plan. If you have a costly medication, one thing you can do is, and if your medication is not on the formulary, you can ask for a formulary exception. If you call the 1-800 number on the back of your member ID card, they should be able to walk you through the process. Or if you have an agent, your agent should be able to help you with that. Another thing that you can do is request a tier level exception. So if you have a medication that's on one of the higher tiers, like a tier 3 or 4 or 5, that's more expensive, you can send in a form to your insurance carrier and request a tier exception. And sometimes they will do that. I have clients that have done that, and they got the tier exception, and it became a less costly medication that way. I've even had people that had to switch their insurance company because they knew that the other company would give them the tier exception, so they moved out of one plan into another so that their costly medication would be less expensive. Another thing that's possible is during annual enrollment period, which we're in right now, goes from every year, the dates are the same, October 15th through December 7th. It's really important to check if you have any new medications that year. Make sure that your medications are in your formulary, and if they're not, compare it to other prescription drug plans. And even if your medications are in your formulary, it's still a good idea to compare every year. You can do it yourself by going to Medicare.gov and putting all your medications in. You can call your broker if you have a broker, or you can call me and I'll be your broker. But there are a lot of changes every year. This year in particular, there's one company that their basic prescription drug plan is going down to almost $0 per month. I have a lot of clients that I'm switching into that plan, and they're saving a lot of money. Yeah, so there are changes every year. There are also changes right now because of the Inflation Reduction Act that our current administration passed. One of the changes that took effect this year is the Insulin Savings Act. So this year, beginning January 1st of this year, any prescription drug plan that has any type of insulin on their formulary, they are not allowed to charge any more than $35. Next year, one of the changes is that if somebody gets into that catastrophic part of their plan, which is a bad place to be because it's very costly, but if you land in that plan for next year, 2024, you won't make any co-payments for your prescription drugs at that point. But you have to reach $8,000 in spending to get there. For 2025, that catastrophic phase, the spending is going down to $2,000. So seniors will not, or seniors and anyone else on Medicare, will not pay more than $2,000 out of pocket for their medications.
Down to 2, it's changed.
Wow. So that's what you would have to pay out of pocket for your medications. That does not include your monthly premium to have the plan. Who knows what's going to happen to that? Usually when things get better on one end, it has to make the opposite kind of change on the other end. So we'll see. But, oh, and then the other thing is every state does have pharmaceutical assistance for their seniors. In New Jersey, it's PACE and PACEnet. So I can always help you get information on either one of those programs if you would like it. So they are some of the most basic ways to find savings on prescription drugs. I guess you're familiar with the 4 different stages of your prescription drug plan. The first stage is the deductible stage. Some of the prescription drug plans have certain tiers that are not included in the deductible. Maybe tier 1 and tier 2 drugs are not included. Once you get past the deductible stage, you have the initial coverage stage, and that's where whatever your prescription drug plan states that they will pay for your medications and you have a copay, then you're paying just the copay and you're not paying the other costs of the medications. After that is the coverage gap, which is also called the donut hole, and then the catastrophic phase. So, if you have an expensive medication and maybe you've already tried a formulary exception and a tier exception and you're still looking for other ways to save, if you're on a generic medication, there are some savings coupons available to you. One of them is called GoodRx. Are you familiar with that?
Oh, yeah.
Yeah, so a lot of pharmacies have that available and might even offer it to you before you ask. If you use GoodRx, then your prescription will go through that coupon and it won't even go through your prescription drug plan. So you can download that app on your phone, and if you have a smartphone with you, I'm happy to show you after the presentation exactly how to do it. And if you type in the name of your medication and your zip code, it will bring up a whole list of pharmacies in your area and show you the price for that medication. So you can just search and see which pharmacy has it at the best price and go there. And that pharmacy will call whatever pharmacy you already have your prescription with and have the prescription transferred. So that can be a easy and convenient way to get some cost savings. There's another coupon like that called Single Care, works in the same way, so you could compare both and see if either one has a good savings for you. There's another one called Visory, but they're connected with Kruger supermarkets. I don't know of any Krugers in this area. I think they're really in a different region of Pennsylvania. So the two go-tos here would be GoodRx or Single Care. And again, they're for generic medications. Their prices will fluctuate month to month. So if you get it filled in November and then you need that same prescription filled in December, I would check again because it might be a different pharmacy that has the better price in December. Okay? Oh, I'm sorry, I'm not keeping up with the slides
I was
here.
gonna ask whether you
sorry
had
about
slides.
that.
Go with
So,
these.
I just started reading. So these are the different stages and costs involved with the drug stages. And again, for next year, they'll be a little bit different when you get to the catastrophic phase. There wouldn't be any cost to you once you reach that $8,000 limit. The insulin savings programs, $35 is the cap now for insulin for seniors, for Medicare recipients is more proper. GoodRx and Visor and Single Care are the two cards that are really good to check on in this area. So, yeah, GoodRx is very easy to use, and I'm happy to show you on your phone tonight if you want me to help you download the app and show you exactly how that works. Visory is another one, and Single Care, they all work in the same way. There are also some online pharmacies. So the online pharmacies just work to give you your medications at a lower cost. And again, if you use these online pharmacies, it wouldn't go through your prescription drug plan. It would not be working towards your deductible if you use that. Cost Plus is one that if you reach out to them, they will get your prescription from your physician and go ahead and fill the meds. They will charge you a shipping fee, but if it's a big savings on the medications, it might be worth the shipping fee. Cost Plus is the one that's owned by Mark Cuban. I don't know if you ever watched Shark Tank. Yes, he started it a few years ago. He just decided he really wanted to help people find a way to stop paying so much for medications, because for some people these costs are just enormous. Cost Plus Drugs is another online company that you can look for. Prescription Outreach is another online pharmacy. So any of these pharmacies, you can reach out to me after the presentation for help with just the general information here, or if you have specific medications that you're looking for help with, if you email me after the presentation, I'm happy to help you with any specific medications that you're looking for help with. Eagle Pharmacy is another online pharmacy. They work with an organization called AbbVie, and AbbVie is a patient advocate organization that helps people to try to find lower cost medications. So just for example, Synthroid is a brand name medication that's very expensive. Eagle Pharmacy can get a 90-day supply for $75. All of the drug manufacturers also have patient assistance programs. So if you're on a brand name medication and it's an expensive medication, you can work directly with that pharmaceutical company for savings. Sometimes your doctor might help you with that. They might have forms in the office that they can fill out on your behalf and send it in, or they can give you the contact information for that pharmaceutical company. Some of these companies will require you to be below a certain income, but not always, so it's always worth it to look into it if it's a medication that is a very costly medication for you, and see if there is assistance available through the pharmaceutical company. So again, some of them will require that you're below a certain threshold, and they use the federal poverty limit guidelines for that. Some of them will be like 150% of federal poverty limit guidelines, some of them might be 400%, so it depends on the drug manufacturer, so it's a case-by-case thing that you have to investigate. My AbbVie Assist is also a patient assistance program. There are 53 medications that they offer assistance with. Some of them Combogin, Humira, Bistolic, and so that's one that's available to people. AstraZeneca has a program called azandme.com. Here are some of the medications that they provide assistance with: Breztri, Fasenra, Symbicort. Genentech is another company that offers patient assistance. So most of these major pharmaceuticals do offer patient assistance, so it's always worth it to look into it and see if you qualify for that assistance. These patient assistance programs are always for their brand name medication. If there's a generic available, then they're not going to offer assistance for the generic. Any questions while I'm moving along? Thanks. Okay, let's see what else. GlaxoSmithKline for You is the patient assistance program from GlaxoSmithKline. I don't know if you'd recognize the name of any of their medications that are on here, but Trelegy is one of them. A nasal spray and different things. Pfizer Pathways is the patient assistance program for Pfizer. Janssen Select is another one. Amgen. There are nonprofit organizations that will also help you. They will provide grants for people that need help with prescriptions. Some of these nonprofit patient assistance will also provide help for other necessities in addition to medications. Needy Meds is one of these patient assistance programs that's a grant foundation type of organization. Pan Foundation. Some of these types of foundations will also help with transportation, clinics, medical equipment, any type of medical necessities that people have that are difficult for that person to afford. The Pan Foundation is one of the largest ones, and they really do a lot to help people with their medical needs. They also will help with some health insurance premiums, some co-payments. So even if maybe you don't need assistance for those type of things, keep it in mind if you ever have friends or family that need that assistance, I'm happy to reach out on their behalf and get them the information they need to apply to these organizations for assistance. This is another type of assistance, mat.org, to provide assistance for medical costs. Good Days is another one that does the same thing. The Assistance Fund. And then the last thing I have to talk about for prescription cost savings is the Canadian Board of Pharmacy. I have a lot of clients that tell me that they get a prescription, maybe one of their prescriptions, from a Canadian online pharmacy. Because if they didn't use that pharmacy, they have no other way to purchase that medication. They're cheaper. A lot of them are cheaper. So the Canadian pharmacies, they have a board of pharmacies, and I have a list of the Canadian pharmacies that are certified and accredited by the Canadian Board of Pharmacy. Very similar to the way our pharmacies are accredited by the United States Board of Pharmacies. So if you order through a pharmacy in Canada that is accredited, the brand name drug you get will be the exact same brand name drug you get here. Your doctor does have to be willing to write the prescription for it. And some of them even do have some generic medications that aren't available here. One of them is Xarelto. Like one of these pharmacies can give you a generic form of Xarelto. Again, your doctor would have to approve that. So, that's up to you to talk to your doctor and see if you would want to go that route. But I have a list of the Canadian pharmacies that are accredited, and people do find a big savings doing it that way. This is one example. Maple Leaf is one that provides huge savings. This is just one. Is anyone here on Janumet? No. I know they also provide a big savings on Xarelto, and they can provide a generic version of Xarelto. This is Januvia still. These are just comparisons. If you're on any of these drugs, you would recognize the costs of them. Xarelto, I mean, that's a very, very discounted price for Xarelto compared to what people pay here. Even with the prescription drug plans that people are on, Xarelto is a very expensive drug here. And Advocate My Meds is another prescription assistance program that people can apply to for assistance with their medication. So just to kind of summarize, if you have a medication that you're on that's very costly to you, the first thing to do is to go to your insurance carrier, see if they'll give you a tier exception. And if it's a drug that is not on the formulary, ask for a formulary exception. Always ask your physician too, because many times they have samples of drugs, and if they know it's a costly medication, they want to pass those samples out to you. They want to help you get that medication. So you can always ask your doctors for samples, and you can ask your doctors to help you with any savings programs available through the drug manufacturer. Okay, so these are some of the other things that I help people with, and my name and phone number, and I do have business cards up here also. So you can reach out to me anytime. This is the best time to review whatever prescription drug plan you're currently on, because you have from now until December 7th to change your drug plan for 2024. And that holds true if you're on a prescription drug plan or a Medicare Advantage prescription drug plan.
Are you local?
Yes, I live in Malvern.
Malvern?
Yeah, I work out of my home. My office is in my home.
Oh,
I
nice.
don't bring my customers into my home. Many times I meet them at a local library, or I come to your home, or maybe a Starbucks.
Wow.
So whatever's convenient for you, but I just, I work in my home. I don't bring my clients into my home. Yeah.
Sounds like a good thing.
Yeah. It works for me.
Yeah.
It works for you, okay.
Yeah.
Questions from anyone here or on Zoom?
This room shuts your, I'm offline because this room shuts you off.
Oh,
I forgot about that.
But definitely, please make sure you check whatever plan you're on now. I mean, I have a woman that I can't wait to go meet with her. She called me a few months ago. Her prescription drug plan costs her right now $88 a month. And the drugs that she's on, she could have easily been on one that was $9 a month. And all of her drugs are on that plan. And next year, that plan that's $9 a month is going down to 50 cents a month. So she's just been paying. And so this is another thing with these prescription drug plans and with the Medicare Advantage plans. Sometimes people are on plans that they signed up for many, many years ago. And it may have been the best plan for them then. And maybe even they were on different medications then. But over the years, the plans tend to get better because they're competing with the other companies. They want their plan to be better. They want more people to enroll in their plan. And so a lot of times, if you don't review your plan, it turns out a few years down the road, it's really not the best plan for you anymore. So it's always good to review it each year. Yeah, yeah, and so like I said, for next year, like there's one plan in this area that currently is $9 a month. It's going down to 50 cents a month. I'm not allowed in this type of presentation to give you names of the companies. I would need you to sign a form allowing me to give you names. But so it's just good to check. it's good to
Like
check.
inside a trading company? No, I'm just-
It's CMS, so
Okay.
Centers for Medicaid and Medicare Services is very highly regulated. So I'm a licensed broker and I follow their rules, because I wanna keep my license.
Yeah, yeah.
So they're highly regulated, yeah.
What were you saying about, I was trying to download GoodRx, that's what I was saying, I couldn't download it.
So I can give you one of their cards if you'd like, but I can also show you on your phone if we have internet here. Do we
No,
have
it-
internet in this room?
It doesn't work in this room. I
Well, let me
remember
at
that.
least give you the card, but again, every pharmacy knows about it, and they should be able to look up and see if your medication is cheaper on
Hey, you know what, it was
GoodRx.
my fault.
Hold on, I'll get the prescription out, I mean the card out.
Yeah, I'm downloading it right now, it was my fault, it wasn't.
Oh, okay, well, if you're not familiar with it, this is the card. Are you familiar with
I've
GoodRx?
seen it.
Okay.
I've used it.
Oh, you have
Absolutely,
used it,
yeah.
would you want the card too?
Yeah, sure, I do.
Go ahead.
Please, thanks.
Would you
The
like the
family
card?
brought together.
Oh, okay.
That's all it takes, thank you.
Okay.
Mm.
And I'll do it all.
Yeah, so, and remember that, if you fill a prescription with it, that the following month, check it again, because the prices change, they don't stay the same. Yeah.
All
That's
right.
funny.
Any questions from Zoom or anybody else in the room? Otherwise, we will wrap up the presentation.
Very good.
All right, thanks so much, Dana.
Okay, thank you. Okay, good.